All right, well, we are live, and here we are, Lynda. It's Facebook Friday. Dr. Gordon and Lynda coming at you from Southeastern Fertility.
Happy Friday.
Happy Friday. TGIF. That's right. That's right. You're working though. You're working this weekend?
Yes.
I'm sorry. I'm off. Woohoo!
What?
I know. I got lots of things. I got lots of home projects.
But you were here the last 2
I
weekends.
was 3 weekends.
3 weekends.
Five weekends. That's something. But we got a lot of home projects. You know, like a honey-do list that's pretty long. Pretty long. So, that's sometimes you get through the weekend and think, I had all the things I was going to do, and I didn't get to them. You know?
I have those weekends all the time.
Yeah, those weekends. Yeah, it's tough. Well, you could catch up on your Olympic watching.
Yeah.
Our Olympic Facebook Friday did not have particularly strong showings. So I don't know. I don't know what I'm just telling you. Every time I'm here with you, the numbers aren't that good. And when you're here with your guest stars and stuff, it's like the phone doesn't stop ringing. Hollywood, Broadway, right. They're all looking. I mean, I'm here and it's like, man, just like crickets, Lynda. There's crickets out there. Well, that's okay.
There should be a lot of people tuning in today because we're talking about a subject that everybody's asking.
That's right, a very important subject, okay? And that is a subject about, what about the COVID vaccine?
Should I get it?
Should I not? Should I wait? Is it safe? I mean, these are important issues, right? So first of all, right, did you get the vaccine?
I did.
Yes, right. Yes, we all got the vaccine, right?
Yes.
In fact, we were just like, as soon as we knew it was available, boom, man made a beeline to get that vaccine.
Yes.
Right. So, and I'm a risk-averse person, but I want to make sure my wife got vaccinated, my daughter got vaccinated, our dogs got vaccinated. You know your dog get vaccinated?
No.
No, your dog was not vaccinated. Well, it was vaccinated, but not for COVID. But
you had me going.
Yeah, you believe me. So, I think so. So I think it really is important. Okay, so here we are. We thought we were sort of in the clear a little bit more than we are, right? And all of a sudden we get this resurgence. Okay, and with the Delta variant, okay, hitting 95% of those hospitalized and unfortunately succumbing are unvaccinated. Okay, so I mean so it's a pretty clear cut in my mind situation. If you're vaccinated, you're protected. If you're not vaccinated, you're not protected, right? And the Delta variant is pretty good at spreading. So again, if you're somebody unvaccinated, I mean, you may be more at risk, right? And that is the issue. That is the issue, right? So as we look at these things, I would say if I'm a patient, I call up and say, Lynda, I'm thinking about getting pregnant. Do you think I should get vaccinated?
Yes, you should.
Get vaccinated. Okay.
As soon as you can.
Yes, right. Okay. Lynda, I'm thinking about starting fertility treatment. Do you think I should get vaccinated?
Yes, you should.
Yes, you should get vaccinated. Okay. Lynda, I'm starting an IUI cycle. Should I get vaccinated?
Yes.
Okay. Yes. Okay. Lynda, I'm in my IVF cycle. Should I get vaccinated?
Get the vaccine.
Get the vaccine. Now here's what I guess when I think about the IVF and even the IUI side, I guess it's so easy now to get the vaccine, right? I mean, you can just pull up to the drive-thru, right? And it jab you, right from the drive-thru. I mean, it's like, it's incredible.
Pharmacies and
clinics everywhere, right? We had the vaccine. I mean, it wasn't initially, right, we're kind of all dashing over to UT to get it, but it's like, it is not hard to find the vaccine, right?
Correct.
So that means that you can probably pick a time that you want to get the vaccine, right? So if you were in the middle of a treatment cycle, I guess if you said, well, what about like the 48 hours before an IUI or the 48 hours before an egg collection or before an embryo transfer? Yeah, I guess I probably wouldn't get it right around there, right? Because you feel terrible and you're like, oh, am I feeling terrible because of the egg collection, or I feel terrible because of this. So I think that, you can use some common sense, right? But when those things are going to happen pretty much, right? There's no reason not to do it. But why get the vaccine? Why not just wait until the end of pregnancy? Why get the vaccine now?
Because you don't want to get COVID while you're pregnant.
Right. If you get COVID when you're pregnant, definitely pregnant women are a higher risk group, right? So we want you to be protected.
Yes.
Right? Now, I hear that you've had some questions, patient wondering, what about the vaccine? Doesn't it cross the placenta and rewrite my baby's DNA so that my child will grow up wanting to be like a Cubs fan like Mark? Yeah, that would be terrible. So we don't want it, but it's not true.
No,
right? It's not true.
true.
So the vaccine, the mRNA vaccine, does not cross placenta, rewrite your child's DNA, so your child will be a Cubs fan. Okay, now, and if you are a Cubs fan and you say that would be a good thing, it ain't gonna help. I mean, the only way for your kid to be a Cubs fan is the Cubs to start winning, right? I mean, or
you brainwash them as you grow.
Yeah, or something. You just convince them that losing is normal and that you shouldn't want to win because winning is not nice, right? Right? Everyone should lose, right? So
that's for you, Mark.
That's for you, Mark. Anyway, so you're right. So I mean, it is not dangerous, not cross placenta rewrite. Does it cause miscarriage?
No.
No evidence to suggest that the getting the vaccine causes miscarriage. Okay. Right. Does it affect your IVF outcome? Shouldn't be any evidence that affects your IVF outcome. Okay. So I think all these things that patients are worried about. Does it cause infertility itself? I mean, I've seen some posts like that, right? Does it cause infertility, right?
There's no evidence
No
of
evidence.
that.
No evidence of that. So I mean, so again, I really think that when you look at clearly the numbers in the country and who is affected, it's the unvaccinated patients, right? And unfortunately, women who are pregnant, very low rates of vaccination, right? Actually, very much a high-risk group in terms of that, right? Mm-hmm. So again, I think that they should get vaccinated. I think it makes sense. And it'd be nice, say, well, worry, so we'll get vaccinated before you're pregnant. Then you don't have to worry somehow that you're doing some problem to some harm to your child, which there's no reason to think that. But then you're already taken care of, right? You're done.
And that's the biggest concern that we get in questions to us is, right. Is it going to hurt the pregnancy? Is it going to increase miscarriage rate? Is it going to hurt my baby?
Right. Exactly. Now, how many IVF procedures are we doing this month in August here at Southeastern?
0.
Why is that?
Because I need a break.
That's right, because Lynda needed a break. So months ago, we had scheduled this as a month off. So it is the perfect month for our patients who are seeking IVF to get vaccinated.
Yeah.
Right? We're not doing it yet.
August will be official vaccination.
Exactly. August is official vaccination month at Southeastern Fertility. There's no reason not to take this time since you're waiting to do, if you're waiting to do an IVF cycle with us or a frozen embryo transfer cycle with us, okay. We're not doing them until September, right? This is the perfect time for you to get in there and get your 2 shots so that you get the Moderna or the Pfizer, right? We were Pfizer, but Moderna's fine. But I'm just saying, this is perfect. It's perfect timing. We couldn't have timed it better if we had already, thought about it, right? Couldn't come up with a better time, right?
Right.
We're shut down.
Yeah.
Planned shutdown for Lynda for her to have a little time, so she's not going to go postal.
Don't send me any hate mail because you want to go in August. They also have to scrub the embryology lab and do things there too. Yeah.
Yeah. Anyway, we're not going to talk about what things you're going to be doing. Yeah, those dirty embryologists need to clean up after themselves. No, that's not true. But we are shut down. It's all good. This is the perfect month. So again, for all of you who are do patients go to other clinics? Sometimes patients go to other clinics. We can't speak to other clinics. We're shut down. We're shut down. This is a perfect time for you to take advantage of that, break in the action, help Lynda have a good month so she's not. Sometimes I'll find her in the corner. Start rocking back and forth. I feel bad. It's my fault. I made her this way. She wasn't that way when I started 2 years ago. It was my 2-year anniversary. It was my 2-year anniversary last week.
Last week?
Yeah, well, actually earlier this week. That's right, you guys missed it. You know what I got? You know what I got for my 2-year anniversary?
Nothing for mine.
Nothing. I zippo. Nada.
You got Dr. Keenan being out of town.
That's right, Dr. Keenan left town. He was so impressed by the fact I've been here 2 years, he took off and went to the Grand Canyon. That's all right. It's all right. It doesn't hurt my feelings.
See, it just seems like you've been here forever. That's why we miss.
Forever. Anyway, that's okay. And
we can't imagine it without you now.
That's right. And it's not like I'm going to be thinking about the fact the staff didn't congratulate me on 2 years of being here when it comes up for their annual reviews this month. So I certainly will have no reason to be thinking about it in terms of that.
Right.
So that's right. So this conversation is all about Lynda's performance review, but actually what it's really about is getting the vaccine, right? So your final bit of advice to patients would be
safe, get the vaccine.
Get the vaccine. Get the jab, right? Jab. Jab, jab.
It's not bad.
It's not bad. It's not bad. Anyway, well, that's what I got. It's Facebook Friday. That's it. We'll see you next week. We'll see you next Friday. And
Next
y'all
Friday.
be safe out there. Get your vaccine. Lynda says,
We recommend you get your vaccine.
listen to Lynda. All right. Y'all have a great weekend.